Being a new mother is a whirlwind of new experiences and emotions. Your body has just done something incredible, and now you are focused on nourishing your little one. Amidst all the diaper changes and sleepless nights, it is easy to let your own health take a back seat. However, this is a crucial time to pay attention to your breasts. Your breasts are constantly changing during lactation. They fill with milk, they empty, and they can feel lumpy or tender. These changes are normal, but they can also make it harder to notice something that is not normal. That is why regular self-checks are so important during this period. You are the expert on your own body, and getting to know your new normal is the first line of defense. Many women think breast cancer is something that happens later in life. While it is true that risk increases with age, breast cancer can and does occur in young women, including those who are pregnant or breastfeeding. In fact, pregnancy-associated breast cancer is often diagnosed at a later stage. This is partly because the normal changes of pregnancy and breastfeeding can mask the signs of a problem. Lumps can be dismissed as clogged milk ducts, and tenderness can be seen as a normal part of nursing. By making breast self-exams a regular part of your routine, you empower yourself with knowledge. You learn what is typical for your body at this unique time, making it easier to spot something unusual if it ever appears. So, how do you check your breasts when they are already so busy? The best time to do a self-exam is right after you have breastfed or pumped. At this point, your breasts are as empty as they are going to get, which makes it easier to feel the underlying tissue. Start by standing in front of a mirror. Look at your breasts with your arms by your sides, and then with your arms raised over your head. You are looking for any changes in size, shape, or color. Notice any dimpling, puckering, or nipple changes. This visual check is just as important as the physical one. It helps you create a mental map of your breasts, so you will notice if the landscape ever changes unexpectedly. Next, it is time for the physical check. You can do this lying down or in the shower. Use the pads of your 3 middle fingers to feel your entire breast and armpit area. Apply light, medium, and firm pressure in a circular or up and down pattern. Make sure you cover all the tissue, from your collarbone down to your ribs and from your armpit across to your breastbone. You are feeling for anything that feels different or new. A clogged duct usually feels like a tender, soft lump that might move and often resolves with warm compresses and massage. A cancerous lump, on the other hand, is often hard, painless, and does not move. Knowing the difference starts with knowing your body well. Knowing what to look for is the key to early detection. While many lumps and bumps during breastfeeding are harmless, certain signs should prompt you to call your doctor right away. A new lump in your breast or armpit that does not go away after a week is a primary warning sign. Pay close attention if the lump is hard, painless, and has irregular edges. Other visual cues are also very important. Look for any swelling of all or part of a breast, even if no lump is felt. Skin irritation, redness, scaliness, or dimpling that resembles an orange peel should be checked out. Any pain in the breast or a nipple that suddenly turns inward, is another reason to seek medical advice. Nipple discharge other than breast milk, especially if it is bloody, requires a visit to your doctor. When you feel something is wrong, it is important to act. Do not delay making an appointment because you are busy or scared. Your health is a priority. When you see your doctor, be specific about your concerns. Tell them exactly what you found, where you found it, and how long it has been there. Explain that you are breastfeeding. Your doctor will likely perform a clinical breast exam. If they are concerned, they may recommend further tests like an ultrasound, which is safe during breastfeeding. A mammogram can also be performed safely. You will just need to pump or breastfeed right before the procedure to get the clearest images. Remember, advocating for your health is one of the most important things you can do for yourself and your family. Sometimes, a doctor might tell you that what you are feeling is nothing to worry about. They might say it is just a clogged duct or a normal part of lactation. In most cases, they are probably right. However, you know your body best. If you have seen a doctor and they have dismissed your concerns, but you still feel that something is not right, it is perfectly okay to get a second opinion. You are not being difficult or paranoid. You are being proactive about your health. Seeking another doctor's perspective can provide reassurance or catch something that was missed. Trust your intuition. A good doctor will understand and support your need for certainty. Your peace of mind is incredibly valuable. Do not let fear of the unknown stop you from taking action. Most breast changes during this time are benign. However, for the small percentage of cases where it is cancer, finding it early dramatically improves the outcome. Early detection is your most powerful tool. It leads to more treatment options and better chances of a full recovery. You owe it to yourself and to the new life you are nurturing to be vigilant. Think of it as another protective instinct you have developed as a mother. You protect your baby, and you must also protect yourself. Your health is the foundation upon which your family is built, so make it a non-negotiable priority. If a diagnosis of breast cancer is confirmed, it can feel overwhelming. The good news is that treatments have advanced significantly, and there are many effective options available. The specific plan will depend on the type and stage of the cancer. Common treatments include surgery, chemotherapy, radiation therapy, and targeted therapy. Surgery might involve a lumpectomy, which removes the tumor and a small margin of healthy tissue, or a mastectomy, which removes the entire breast. Chemotherapy uses powerful drugs to kill cancer cells throughout the body. Radiation uses high-energy rays to target and destroy any remaining cancer cells in the breast area after surgery. Targeted therapies are newer drugs that attack specific characteristics of cancer cells. Your medical team will explain the best course of action for you. Recovery is a journey, not a destination, and it looks different for everyone. Physically, recovery involves healing from surgery and managing the side effects of treatment. Side effects from chemotherapy or radiation can include fatigue, nausea, and hair loss. Your medical team will provide medications and strategies to help you manage these. It is important to be gentle with yourself during this time. Your body needs rest to heal and rebuild. Light exercise, like walking, can help with fatigue and boost your mood when you feel up to it. Eating a nutritious diet is also essential for recovery. Focus on whole foods like fruits, vegetables, lean proteins, and whole grains to give your body the fuel it needs to get stronger. You will likely need to make a decision about continuing to breastfeed. Depending on the treatment, it may not be safe for your baby. For example, chemotherapy drugs can pass into breast milk. Your doctors will guide you on this. This can be a very emotional decision, and it is okay to feel sad or guilty. Remember that feeding your baby with formula is a perfectly healthy and loving choice. Your health must come first, so you can be there for your child in the long run. The bond you share is built on love and care, not just on how your baby is fed. Recovery is about more than just your body. It is about adjusting to a new reality and finding strength in different ways. Life after treatment involves ongoing monitoring. You will have regular follow-up appointments with your oncology team to watch for any signs of recurrence. This is a normal part of the survivorship journey. It can be a source of anxiety, but it is also a safety net. This new normal might mean living with some long-term side effects or scars, but it also comes with a new perspective. Many survivors find a deeper appreciation for life and a renewed focus on what truly matters. Recovery is a process of healing your body, mind, and spirit. It is about learning to live with the experience and moving forward with hope and resilience. A breast cancer diagnosis does not just affect your body, it takes a significant toll on your mental and emotional well-being. It is completely normal to feel a storm of emotions, fear, anger, sadness, and anxiety. Acknowledging these feelings is the first step toward managing them. Do not feel like you have to be brave all the time. Find healthy ways to express what you are going through. This could mean talking to a trusted friend, partner, or family member. Journaling your thoughts can also be a powerful outlet, allowing you to process your emotions without judgment. Many hospitals have support groups for cancer patients, which can connect you with others who truly understand what you are experiencing. Taking care of your mental health is just as important as your physical treatment. Make time for activities that bring you comfort and joy, even if you only have a few minutes. This could be listening to music, spending time in nature, practicing deep breathing exercises, or engaging in a hobby you love. Mindfulness and meditation can be excellent tools for calming an anxious mind and staying grounded in the present moment. If you feel overwhelmed by anxiety or depression, do not hesitate to seek professional help. A therapist or counselor specializing in oncology can provide you with coping strategies and support tailored to your situation. Prioritizing your mental health is not selfish. It is a necessary part of your healing. Your family, especially your partner and any older children, will be on this journey with you. They will have their own fears and feelings to deal with. Open and honest communication is key. Talk to your partner about your fears and listen to theirs. Work together as a team. For children, it is important to explain what is happening in an age-appropriate way. Reassure them that they are loved and will be taken care of. Let them know that it is not their fault and that it is okay to be sad or scared. Maintaining routines as much as possible can provide a sense of stability for them. Accepting help from friends and extended family can also ease the burden on your immediate family, giving you all more time to focus on healing and being together. Finally, hold on to hope. A cancer diagnosis is life-altering, but it is not the end of the story. It is a chapter, and you are the author of what comes next. Celebrate small victories along the way, completing a treatment, a good report from your doctor, or simply a day when you felt strong. Surround yourself with positivity and people who lift you up. Look for stories of survival and resilience. You are stronger than you think, and you have a powerful reason to fight, your beautiful family and your own precious life. This journey is challenging, but it is one you do not have to walk alone. There is a community of support ready to hold you up, and there is always hope for a bright and healthy future.